So at Rogers, when you come for treatment, usually people are struggling a lot and unable to function and unable to go to work, go to school, unable to have healthy relationships with their family, spouses, kids, parents. And here we are, able to help, and we understand where they're coming from.
Oftentimes what you'll see is jack of all trades but master of none, and that's problematic. It's problematic because when you're really working with specific clinical presentations that require specialized care, you're not always getting the gold standard of that. At Rogers, we provide the gold standard for that. I know that in Miami, there's nobody out there that provides this level of care for OCD and anxiety specifically. It's needed. It's really needed. We're filling a very huge gap.
In South Florida, we have such a diverse community, and there is such a need for multilingual, culturally competent therapy. We need Spanish language therapists. We need Creole speaking therapists. In that regard, Rogers is a trailblazer as far as that level of care, to be able to provide a higher level of care in the languages that meet the needs of the community.
And I was very surprised when I saw the first time the book that they have and the practice books they carry for exposures and treatments and groups and things like that. It's also they have it in Spanish. I don't think other places will do something like this. So they're thinking on the patient, and I think that's amazing.
I think that what makes Rogers really unique is that there's a multidisciplinary team, which means it's a team composed of psychiatrists, doctors, therapists, that all work together and collaboratively for the good of the patient. We're all involved with our patients. We all talk to each other and have in mind what the patient would like to have as an outcome.
Here at Rogers, we do provide family sessions with a family therapist to kind of tackle the family and tackle where improvement needs to be made, where a conversation needs to be had. Even if they don't want to have it in their home, they could always just have it here. Many families have immigrated from here, faced deportation, faced families being separated at the border, and just having that support is by far probably one of the biggest aspects of a person getting better.
Being trained as a family therapist, I can't imagine not being able to involve the family, especially of a young person, because the family has so much influence on this young person, and they could affect so much change if they're willing to participate.
I think you just have to kind of normalize their experience, get them to understand that they're not the only ones that are suffering from this, and that it's not a bad thing to have emotional problems. I mean, a lot of people suffer from depression and anxiety, and it's something that's treatable, and it's not something to be embarrassed about.
Recovery means being able to manage the symptoms, being able to manage the anxiety, the depression, and being able to then have the skills to help you go back to your routine and move on and function based on what you care about, your values. What Rogers does really works.